What results have you seen with your population health initiatives? What changes do you expect in the near future?
So we've had some real successes with population health because up to this time we've really been in a fee-for-service environment. Most of our population health initiatives have really had to be pilots. They haven't been things that we could afford to scale because most of these efforts are not rewarded under fee-for-service. So, but knowing that the day is coming when we will be in a value-based environment and we're going to need these population health strategies, what we have done is create a number of pilots to test things to see could we improve population health. And then if it works, then we know we've got something we can scale. There's many examples. We have a program that we designed around childhood obesity that's had some real promising effects. We've also created a metabolic clinic, which is not paid for by all payers under a fee-for-service environment. But what we've shown is that we can get some tremendous gains in managing chronic disease and improving people's health, and that this is then in turn leading to better health at lower cost. So those are a couple of examples. There's a number of other things that we've done. For example, developing competencies and skills around management of care transitions, which contribute to a lot of the cost for especially those that have more chronic diseases. And we've seen real cost opportunity savings with those initiatives too. So I think, that's what we've been doing so far. What will be coming is really taking the populations that we're at risk for, then sub-segmenting those populations. Because what we don't want to do is deploy our population health strategies as a shotgun across all these populations. We want to tailor those strategies to the specific subpopulations. So for example, when you have a healthy patient who does not have a lot of risk factors, there's not a lot of resources that need to be deployed to that population. Contrast that all the way over the other extreme where you have a patient with multiple chronic illnesses. That's the population that's accounting for a far disproportionate amount of the cost and spending. And the programs that we need to manage that population center around disease management, care coordination, management of care transitions. So those are the programs that we're going to tailor to that population. So that's where this will be going, is to identify those population subsegments and then tailor strategies for each of those subsegments.